All right, welcome everybody to this coffee lecture by the Information Center Chemistry, Biology and Pharmacy of ETH Zurich. Today I will be talking about DrugBasePlus, which is a search portal for pharmaceutical information. And yeah, we have three topics or three examples that I will be talking about, a bit about cough, about strawberry flavor, and also about a cancer treatment. And maybe the first question is, what is this DrugBase? So it's a portal that has information relevant for pharmacists, doctors, and researchers. There are 4 resources that are simultaneously searched, and it will be displayed in which your hits have been found. So there's the Index Nominum, which is a list of drug brand products, and you can also search for different countries. Then Hager's Encyclopedia is an encyclopedia on drug substances. There is a resource on injectable drugs because they are special, or they have higher standards also because they get injected into your blood or into your body, and so that might be problematic. And then finally, excipients are substances that are not directly relevant to the medication, so they're not the active ingredients, but they help. They maybe for stability, for flavor, for appearance, and whatnot. So why would you need this? There is curated and aggregated data, so it can help you get the overview. It's regularly updated, and it also has references if you want to read on. And as mentioned, it has a certain key audience. You can access it via plus.drugbase.de. So, and you will also notice that part of it is in German. And now I'm going straight inside. We're talking about cough now. And I want to go in here as fast as possible because at ETH we only have 1 seat, and if somebody logs in, then no one else can log in. And so I've logged in a bit before this lecture because I've had it 4 years ago that actually when I tried to show it in the coffee lecture, somebody else was in there, and I had to work with screenshots. But today we are happy. And so now this is the interface as it looks, or can show it like this. I'm searching for Bexin, which is a cough syrup that is sold in Switzerland. And you see we have an entry in the Encyclopedia and in the Index Nominum. And there's also others which are shaded out because we haven't licensed them. And so I click on the Index Nominum because I want to actually figure out what is the active substance that's inside this cough syrup. And here we see a substance that has been matched to the Bex of Bexin, but that is not a proper hit. And so I go to product, and then I find the Bexin that I actually want. And we can also, here on the right side, there is filters. And if I'm only really interested in the Swiss products, I can filter for these. And then we have Bexin and Bexin Hustenlöser, but there's other matches that are actually not correct. And I think there's something a bit wrong with the search. They've implemented a new portal for this database, and I think it's not going completely fine so far. Okay, so let's look. I click on an entry. It says here, it's still an active thing. That is now for the syrup. We also see the dosage information. So it's 25 mg per 10 milliliter. And here there is the name dextrometorphan, which is the active ingredient. We see we have the free amine substance, but also then the hydrobromide salt, which is a monohydrate. So I'm going to click on this. Then we get a structure for it. And we also have some more information also here, for example, the CAS number, which might be helpful in finding more information, especially if you want to avoid that weird matching that we currently see. And then we have some information on the chemical, different chemical names, on translations of this active substance. And if we go further down, also references to certain pharmacopoeias, and wherein that you can look up entries to find more details. And then again, we have the list of products. But now, so this was the Index Nominum. the list of brand name products. Now I want to learn a bit more about this actual substance. So I'm going to go back to the outset, and I've copied the CAS registry number now. So I'm going to use that for the search. And now we are looking at the Hager's Encyclopedia to learn a bit more about this substance. And we find it here. The bromide as a hydrate. And again, we have some general information, CAS number, molecular formula, molecular weight. If we go down, we have again the synonyms. There is some information on the synthesis. It's not very elaborate here. It just says, oh yeah, the HBr salt is formed. And then there is some chemical information, which typically in the pharmaceutical application serves for analytical purposes or quality control. And so you have relevant values for the typical methods that are used for this. Also, how you can confirm the identity, purity, the content, and how this works. And then there is this, and you see this is now a German part of this resource. And then it says, well, if you want the actual information on the pharmaceutical description, then you need to go not to the HBr salt, but you need to go to the plain compound. And so we can do that and just search for the parent compound. And in here, we have a similar amount of information, but here, if we click on the pharmaceutical description, then we have something on the effects, on resorption, distribution, elimination, on clinical applications, side effects, and so on. So there is really a lot of information. Okay, so the third thing I wanted to show you is the excipients database, that is the Fiedler. And here I'm going to come back to the strawberries that I mentioned. So this is about flavor. And we have here an entry on flavor, but these are the natural ones. And if we go down a little bit, we have here an entry on synthetic flavors. And that's actually hasn't been updated in 11 years, but still there is relevant things. And we have here for preparations that have flavors with the sweet taste. We have flavors with the bittersweet taste and the bitter taste. And I can search a little bit in here. Straw. And then I get a compound that is actually listed here as a strawberry flavor. And I have a second one in this bittersweet section. And I could, of course, then look further for this. But I don't want to dwell too long on this. As mentioned before, here we can find things like oxidative stabilizers, acid-base stabilizers, additives that help formulations that are powders, so they don't form lumps. And all kinds of other substances that are not only used in pharmaceutical preparations, but also in cosmetics. Because as soon as things start to get into contact with your body and are applied regularly, they of course also have to fill some more stringent criteria. And then finally, let me talk about the injectable drugs. And for this, we're gonna search for paclitaxel. I think I have to go to the entire DrugBase again. Yeah, so if I search for this, I get a type ahead. I think I still have a typo, so that is better. And here I want the injectable drug information, so let me look at this. And I don't know why this is written in these weird capitalizations. I think that shouldn't be like that. And so that is Taxol, which is administered against various types of cancer. And yeah, so why do we need this? As said, if you inject a drug, it needs to fulfill higher quality criteria. It needs to be sterile, so that there is caution with handling, but also with storing these compounds. So stability is a big issue. There is information on administration, on what conditions these compounds are stable, and also because if something is dissolved in a physiological or physiological like fluid, then it can precipitate, and you don't want to inject solid substances into human. There is issues with plasticizers, so there is information on that aspect. But what is really important, and that's down here, is the compatibility, because oftentimes, for example, cancer patients, they don't receive only one medication intravenously, but a mixture of them. And of course, if you mix these substances together, you want to be sure that they are compatible with each other and don't do anything unwarranted. And so you can look up here what works. So these are mainly just different kinds of solutions at different concentrations. And if we go further down, we have other medications. So here, for example, carboplatin and cisplatin are other cancer medications that are then co-administered. And of course, you don't want one of the compounds to destroy the other. And with that, I'm almost at the end of what I want to show you, because I also have a small summary on a coffee lecture card. So I will quickly copy that link into the chat for those watching remotely. And for you here, you can find this in the front. So here is the link. And then I also want to highlight tomorrow's coffee lecture, which is going to be the last one of this series, which will be about Dimensions, a literature database where you can not only find papers, but also information on grants. So who has received what kind of grant in the past of certain countries, and also international policy documents. So if you want to see what kind of science has an impact, for example, on UN or WHO policies, that is a way to find out, which can also be interesting. But there's many other things that you can do with Dimensions, and so I invite you to join us tomorrow to get a quick glimpse. And now, if you have any questions, feel free to ask. Thank you for joining us and your attention.